How to fix shoulder pain. Shoulder pain can happen to anyone. It can affect your cartilage, ligaments, muscles, or tendons. After watching this video, you'll be able to understand where your shoulder pain is coming from and how to treat it. You'll also learn when it's best to use cold or heat in treating your shoulder pain. If you have any questions, please write them in the comments and we'll answer all of them. Disclaimer: if you're experiencing intense pain or know that you have been injured, immediately see your physician. If you have a generalized light pain in your shoulder, you can try to treat it on your own, and you'll learn how to do so by watching this video. However, if the pain doesn't go away after a couple of weeks, you should consult your physician. How to understand the pain source. Let's try to find out the source of your shoulder pain and if it's originating from your bones, muscles, tendons, or joints. Now, bone pain is usually deep, penetrating, or dull. It's usually caused by trauma. Muscle pain is weaker than bone pain, but can cause extreme discomfort. It can be caused by damaged muscles as a result of trauma, stretching, blood supply disruption, infection, or swelling. Pain in the tendons or ligaments is usually sharp and is worsened when stretching or moving the damaged tendon or ligament, and the pain isn't as extreme when at rest. Joint pain is worsened with movement, but doesn't go away even while still. In cases where the pain is caused in ligaments, tendons, or joint capsules near joints, the pain may also be felt in the joint. Thus, it's hard to diagnose independently. A medical exam can help accurately determine the cause of your shoulder pain. Additionally, a doctor's consultation is necessary to find an effective solution to your problem. Now we'll tell you about simple solutions that can help heal your shoulder in household conditions. How to stop shoulder pain in household conditions. Each problem requires an individual approach, so follow our general advice carefully and always listen to your body. Rest. Try to avoid putting stress on your shoulder for at least a couple of days. This means not lifting heavy objects, not raising your arm, and not pulling objects. Bed rest isn't the best idea since you need some movement to stimulate blood flow and engage your rapid healing response. Sleep. Change the position that you're sleeping in. Shoulder pain may be caused by mattresses that are too soft or pillows that are too thick. To decrease your shoulder pain, sleep on your back for a few days or even a week if necessary. Picking the appropriate pillow to put under your head can also unburden your shoulder joints. Cold. Cold compresses constrict your blood vessels and limit blood flow and decrease the sensitivity of your nerves. Use ice every hour for 10 to 15 minutes to decrease swelling and pain after trauma or injury, and then decrease the frequency after the pain in your shoulder has decreased and the swelling has lessened. Make sure to wrap the ice or frozen gel bag in a thin towel in order to avoid frostbite. Heat. A heating compress can help with chronic pain. A wet heating compress in the morning will soothe the pain, decrease the numbness, and increase your shoulder's mobility. For example, do this if you have non-inflammatory osteoarthritis in your shoulder for wear and tear in the tissues. And if you're using a heating pad, avoid burns by not placing the pad directly on your bare skin. Stretching. If your muscles are moderately strained, a light stretch can help by removing the muscle load, improving blood flow, and restoring flexibility. Stretch your muscles without any sudden movement for 30 seconds 3 times a day. Pain medication. Non-steroid anti-inflammatory medicine such as ibuprofen can help decrease swelling, pain, and fever. Without consulting your doctor, you should take this medication carefully and for no longer than 5 days. Always read and follow the instructions of any medication you're taking. As an alternative, you can use an ointment, cream, or lotion for your shoulder that has natural pain-killing ingredients. Menthol, camphor, arnica, and capsicum can help decrease your muscle and bone pain. Now make sure that you're not allergic to these compounds before using them. Let us know in the comments if our advice was useful and helped with your shoulder pain. Heat and cold. Which is better to use for shoulder pain? Like in any other pain management situation, there's not just one answer. There are situations where either option is beneficial, and everything is good in moderation. As we mentioned above, cold is good for acute pain and to decrease inflammatory reactions. It's also good to decrease swelling after injuries and to decrease sharp pain. The use of heat is good for treating chronic pain, like pain in your joints caused by rheumatoid arthritis. Heat relaxes and can help decrease rigidity and tightness in the joints and muscles. Scientists from the Cleveland Clinic have developed hints that can help you determine if you need to use heat or cold to treat your pain. Rheumatoid arthritis, heat. Strain, cold to decrease swelling, and then heat to decrease tightness. Acute ligament inflammation, cold. Chronic ligament strain, heat. Dislocation, cold to decrease swelling, then heat to decrease tightness. In some cases, using heat and cold can treat the pain, but it's also worth consulting your doctor about the relative benefits of using these methods in specific cases. Thank you for watching. Let us know in the comments if we answered your questions. And what topic would you like to see in a new video? Watch our other videos and stay healthy.